Good afternoon. Welcome everybody to the third webinar of our webinar series, What After BAMS. This series is intended for Ayurveda graduates to explore career options through the professional examples of various speakers. We have invited speakers who have excelled in industry, clinical practice, government service, research across different environments. And through these examples, we would like to encourage students to discover new ways in which their Ayurvedic training can be deployed in healthcare. So in this series, today we have a very noted clinical practitioner, Dr. Pendse from Pune. He also sits on our board of governor, and he's very intimately involved with the research programs that we have undertaken. I will not elaborate on Dr. Pendse's tutelage and his education, which he will talk about. Instead, I would like you to give a very personal introduction. Not coming from Ayurveda, our education, or at least mine, has started in TDU. And I would like to appreciate and inform our participants that Vaidyas like Dr. Pendse serve as a fountain of information and direction in terms of understanding the classics. I have always found that he has very considerate responses and allows people to explore the science in a language that they are comfortable. So I hope he will also be able to equally inspire you to explore what you have learned in a way that is individualized and personalized to your career choices. With that, I would like to request Dr. Pendse to take over and start.
So thank you, Megha, for that wonderful, insightful introduction. I appreciate, and I also cherish the moments that I could help in various levels at TDU. So thanks also for providing a certain set of slides so that I can just walk you through those. As Megha mentioned, I have been a private clinical practitioner, primarily in Pune and Mumbai, last 8-9 years also at Bangalore, and I have been visiting elsewhere outside of India, trying to do my work as an Ayurvedic physician. So I graduated in 1991 and I completed my MD Ayurveda in Kaya Chikitsa. For people of a younger generation, we didn't have MD Panchakarma at that point of time. That started a few years later. But the topic which I chose was a topic in Panchakarma. At that time, you had the freedom of choosing Panchakarma or Shaman Chikitsa for your MD thesis, and I chose Panchakarma. That really helped me because more than Shaman Chikitsa, in Panchakarma, you have to be with your patient and handhold them, and at the same time, you get to learn. I was fortunate to have multiple mentors in Pune, Mumbai, and Vadodara, and my teaching as a trying to teach Ayurveda started probably with Dr. Arvind Kulkarni, who was at that time head of radiation oncology department at Bombay Hospital, Mumbai. And he was keenly interested in Ayurveda. And I used to go to Bombay Hospital, sit down with him and discuss some aspects of Ayurveda. And we spent many, many Saturdays doing that. And that really helped me also understand oncology a little better than I could as a BMS, because this was just between my interim when I was completing my BMS and venturing into MD, and a few years after that. And my guide, Vaidyas Sardeshmukh, was kind enough to allow me to do so. So I learned different skills from different mentors. Then I had an opportunity of teaching Kaya Chikitsa and Panchakarma at the Tilak Ayurveda Mahavidyalaya for almost more than 25 years. I was fortunate to have head of departments, 3 or 4 of them, who were kind enough to allow me to teach that which I thought was the right topic for my students before me, may it be graduate or postgraduate. So I was not confined to teaching verbatim by the syllabus. And I think one of the things which really helped me is that I used to take up topics by demand from students, because I had just recently graduated as a student, both graduate, postgraduate, and some of the topics which I started teaching was Avrut Vatavyadhi. And I really think my understanding of Vatavyadhi and my growth as a Kaya Chikitsak really started by those earlier years of teaching, as well as teaching bedside decision making. Now, this is my 30th year of being associated as a consultant at Tarachan. Earlier, I was there for 8 years as a student. So, both teaching in the classroom, and in the last roughly 12 years, I have been teaching only bedside. I don't teach in a classroom any longer. And I like to really show students how they can apply that which is given in the Shastras into a real day-to-day clinical practice. I have been or used to be a member of advisory committees. And as I mentioned earlier, I have traveled abroad to learn a little more of application of Ayurveda in foreign countries. Day in my life usually starts with private practice in the morning, also in the evenings. And then I take my rounds at the Tarachand Hospital. As I mentioned earlier, for roughly 6 or 8 months ago, I was practicing every weekend in Mumbai, which I have finally stopped due to some family engagements. And now in the last 8 years, as Megha mentioned, I have been honored to have a small part at TDU. So what are the skills needed to succeed as a private practitioner? Patience, perseverance, and passion to learn. I have absolutely zero uh, obstacle or difficulties in saying to my patients or students, I have not heard of this disease at all. This is the first time I've heard of this. It wasn't in my syllabus when it was prepared. This is a new disease. I don't know. Let me give my best efforts. But that really keeps me very keenly interested in my practice. And I really try and see to it that my patients get better sooner, faster, stronger, and they're able to leave my clinic happily so that I get new patients to see. See, my curiosity to understand, I think, exceeds my practical needs to practice. And I think that has kept me fresh and alive in my practice, because I never have a dull day in my clinic. I always keep learning from them. And I think one of the beautiful things of a practice in India is that you usually get a lot of respect for what you're doing. People open up, they consider you part of a family, and more important, they pay you for your own learning. So that's one of the factors which I always find beautiful, that I am being paid to learn a little more. So communication skills are very important. And I would certainly guide you to one of the best books that I have read on communication, which was published by, I think, the St. John's Hospital in Bangalore, about care and compassion for the patient and how to enter into dialogue right from the watchman, storekeeper, pharmacy to the senior consultant. And I think it's a very, very well written book. I think it's available, and perhaps you could ask them to make copies available, Megha. That's a really good. I learned a lot from that book. Second thing, if you do indeed wish to practice or want to go abroad or have patients coming in from abroad, you need to know the context in which they're asking questions. So try and read up on their social milieu, some of the books which are available over there. Now, my experience pertains only and only to North America. So in my formative years, I used to read a lot of Deepak Chopra and Vasant Lad and David Frawley and so on, because I was intrigued by the questions that they used to ask me, the people around, the academics around, and I just couldn't figure out where did they get this doubt from. But then once I started reading, I could understand that they had not read the original classic Ayurvedic text, but they read descriptions of Ayurveda in the likes of Chopra, Frawley and Lard and so on. All of them write very well, incidentally. So my suggestion is focus primarily on successfully treating patients. Keep Saraswati as your vehicle and Lakshmi will follow suit. That's something which I learned from my guru. that you need to really focus on treating patients. And I tell you from first-hand experience, not only me, I've been teaching for 30 years, all of the students that I have had who have focused primarily on getting patients better, they have never ever had any want for Lakshmi. I'm a firm believer that if you do service and use Saraswati properly, your knowledge, Lakshmi is bound to follow. And you need to also be adaptable at practicing both dispensing practice as well as consulting practice. And consulting practice is slightly more difficult because you really need to know what kind of brands are out there in the market, what are the dosage forms, how many tablets come in one packing, what's the rough cost, what's the next best option available, which companies have all India network, which have geographical spread only, localized spread. And you also need to be very good at your nidan, that is diagnosis, because usually if you write more than 3 medicines internally, the patient is unhappy because he finds it too cumbersome to take medicines. So this is something which I usually teach my students, rule of 3 internal medicine. Sometimes you need to go up to 4 or 5, but try and keep it simple for the patient. The more complex the consumption of medicine is, the more difficult for the patient to comply with, especially in the elderly and children. So the moot question for which I think Megha has called me over here is right before you on your screens. That you really need to know why you want to do your MD. Now, some people do it just because they like to have a second degree on their nameplate or their visiting card. And I completely subscribe to that. But also please remember that there's a huge cost involved. Education in India, especially postgraduate education, is no longer cheap. And there are also indirect costs because you are staying at some other place, etc. My personal experience with some of those who just did BMS and now are in very good ethically practicing positions in and around Maharashtra or even in Goa is that they spent 3 years understanding the new geography, understanding the way people behave, their food practices, their cultural milieu. And I think that really helped them much more had they spent those 3 years just pursuing an academic degree. So it depends upon what role you envision for yourself. I also have students who have decided from day one that they would like to enter government positions or academic positions. Now, if you want to do that, then you need not stop at MD because now the asking is for PhD. So good strength to all of them who want to do that because they have their own life choices, whether they want to do a job or an academic position. But if you want to be just a good clinician and practice as a practitioner or a family practitioner or even a specialist, just find some good mentors and just train with them. The classical Guru Shishya Parampara, because it's far superior than anything that you can learn from a book. But of course, there's a caveat to it. That if you are in a surgical branch or would like to pursue surgical branches, set up your own hospital with integrative medicine, then of course you need to have postgraduate that is now legally mandatory. Earlier, you could do surgeries with just a BMS degree, but I think that has passed in the last decade. Now you really do require, and there have been medical legal cases where people haven't had that particular specialization and they have caught themselves on the wrong side of law. So if you want to pursue surgical branches, postgraduate is absolutely necessary. But make sure that for that surgical branch, you select a hospital with good workload. If unfortunately the hospital where you have applied and had got entry, because it's a tough competitive entrance exam oriented thing, then make sure that even if your postgraduate training hospital doesn't have good patient workload, you have consultants or surgeons who come there who are willing to teach you at their hospitals or take you around for rounds, because that's also surrogate learning. But I think do spend a little more time in trying to find the right hospital and do meet students and meet them outside of the campus. Okay, take them for a cup of tea, because inside the campus students are very nervous about speaking bad about their own institute. So take them out. Okay, it's money well spent. I'm just sharing some examples of plain basic BMS or basic undergrads, because the degrees of some of the examples used to be referred to by some different nomenclature than BMS. But basically, it's an undergraduate degree. And there are multiple examples. Just to suggest, if you look at the Rashtriya Ayurved Vidyapeeth website and look at the 83 gurus on that website, roughly 30 of them are from Maharashtra. And I think almost 30 to 35% of them have only a BMS degree. But they were considered good enough by the Rashtriya Ayurved Vidyapeeth to be referred to as a Rashtriya Guru or a mentor, and students can learn from them because the quality of the work that they do is good. I'm just choosing 3 of them. This is one of my personal, had I been born early, I would have met this guy kind of person. Some I look up to, Vaidyas Acharya. He had roots in Porbandar. Well, the rest of his life, I think, he spent in various spaces learning, but eventually settled down in Mumbai to practice. And he's one of those few Vaidyas who recently in 2019 were honored, I think the first time post-independence, that Vaidyas, Hakims and homeopaths were recognized by the Indian government in having commemorative stamps published in their name. And he was certainly a giant in the field of Ayurveda, passed away in 1956. And as I showed in my slide earlier, he was just 66 when he passed. But he was all of this, an acclaimed physician. He was the first vice chancellor of the Jamnagar University. Unfortunately, he passed away very soon, so he couldn't really fulfill his dream at Jamnagar. But he edited the Bruhat. I always keep wondering if Yadavji Trikamji hadn't been born, and at the age of 19, he started going through manuscripts and created an edited version of all of the Bruhat, most of the Laghut, and almost went on to publish 54 books. That's a huge contribution starting at the age of 19. And he was contributing books right up to the end. His family is also very well educated. One of his sons is a surgeon who has republished some of his books recently. Those books are not, of course, the Bruhat. Those are books which basically capture the lifetime learning that he had. And please remember that he was as good as Ayurveda as he was at Unani. That's a very, very rare combination. He was very fluent in Urdu, and so he could practice and had a scholarship of both Ayurveda and Unani. One of probably a very few people in India who had a learning in both. And he reorganized the texts of the Charak, etc. In its introduction, you'll find that it's all organized as per topic and avastha. It's very useful to refer to that edition of the Charak to find out answers in day-to-day clinical challenges. And he also was a prolific writer and wrote a book on Vyadhi as well as Dravya Guna. So he really was a giant in that domain, and rightly so, he was commemorated with a stamp. This is more near to my home, and of course, one of my mentors, Vaidya Madhav Kulhatkar, he was just plain DSAC, that was the degree earlier, Diploma in the Science of Ayurveda and so on. But his contribution was immense. As I mentioned earlier, if you look at the list of Rashtriya Ayurved Vidyapeeth recognized gurus in Maharashtra, say 30 of them, at least 20 or 22 of them would be humble enough to say that we draw our inspiration and we were inspired to take up Ayurveda as a choice instead of following at that time the popular means of using an Ayurvedic degree to allopathic practice. We decided to do pure Ayurvedic practice because of him, because he used to travel a lot around Maharashtra on his own money. He wasn't taking money from anybody. In fact, he used to teach at one of the Ayurveda colleges in Pune for just ₹1 per month because he was passionate about teaching. And he was just a people person. He wanted to meet students. He used to go to their home. explain to the parents as to why this boy or girl should take up Ayurveda, understand what specialities does the child carry to pursue a particular specialized area of Ayurveda. So he was really, really caring about all students. And I know multiple examples where he had helped students set up their own practice. And he was truly a Vidyarthi Mitra, friend of students. But his contribution to Ayurveda as a society, besides giving rise to multiple students, practitioners, he was a bridge between various schools of Ayurveda. Now, please understand that Ayurveda traditionally has been like the domain of music. You have the Jaipur Gharana, you have this Gharana and that, and they will usually not allow students to mingle between different Gharanas. There is a certain logic behind it, but he was one of the few people who could meet almost any tradition chief and be considered by that tradition chief or that school chief to be his best student. So Madhav Kollatkar in his lifetime had many schools of Ayurveda considering him as their best student. And that's why the doors would open for students recommended by him to get tutelage under a particular guru or mentor. And that depended upon the abilities of both the guru and the student. He was a master of understanding who would do well with good Sanskrit background and who would do well with zero Sanskrit background. So he didn't have this dogmatic approach to who should take up Ayurveda. And he also had the courage and the vision to start the encyclopedic work of the Triskanda Kosh, Hetu Linga and Aushad Kosh. And it's a huge collection, very well organized. Of course, his student, the Dilip Gadgil, has been associated with TDU, and his team of associate editors completed the project. Unfortunately, passed away before the work could get over. And that's why I would consider him as one of the lighthouses for people who are looking at or thinking that what can a BMS graduate do? Now, more nearer to home, in the Konkan area, this is a doctor called Dr. Ashok Ketkar in his 60s, graduated from Pune, and he practices allopathy and Ayurveda both. He also learned homeopathy because for some reason, though he didn't have any postgraduate degree, it so happened that his practice with children, pediatric practice, just flourished. And even today, he is one of the go-to doctors for pediatricians or small children because he has an immense level of trust developed in Chiplun and the neighborhood because he has been practicing for 40 years. And the reason he learned homeopathy was that he realized that getting good Ayurvedic medicines, especially churnas, with good shelf life was being very difficult in a small city like Chiplun in Maharashtra, and the shelf life was poor. So he learned homeopathy by traveling overnight to a good homeopath's place, learning homeopathy, and homeopathy had good shelf life. It was also easy to use. And wherever there was a need to use allopathy, he was using it. So please remember that my personal opinion is that if you have learned the science well, if you have learned Ayurveda and only Ayurveda well, use Ayurveda. But if you have the capacity, tenacity, and years toil bedside with a good teacher in learning both allopathy and Ayurveda, just go ahead, practice both. If you have homeopathy, learn that. But the point is that whatever you learn, know your limitations and then practice. Coming back to Dr. Ketkar, he also used kirtan, that is religious sermons for health awareness in the small villages and padas near Chipur. Please remember, though Maharashtra is considered to be one of the industrially advanced states, I think at number one, and immediately later is, I think, Tamil Nadu, the level of healthcare penetration in Maharashtra is also still very poor. And there's a huge amount of ignorance in society. I think that might hold true for many parts of India, but he used kirtan and he used to go to do kirtan after his evening practice was over after 9 p.m., 10 p.m., come home at 12. And this was all gratis, just because he wanted to spread the word and give knowledge to humble village goers. And then he studied the high incidence of ophthalmic disorders. For that, he interned after starting practice for 15, 20 years. Then he decided to intern with an ophthalmician because he wanted to be able to understand ophthalmic diseases, because he used to hold camps using the Lions Group, Rotary, and so on. So even a person with a humble background of just an undergraduate degree has contributed a lot to the local society in Chipur and around. In summary, I would say that the role of physicians, regardless of pathy, is multifaceted. It has always been multifaceted. And please remember that, please disregard the number of practice, competition. Big words mean nothing. You have to treat only one patient well at a time. Even if you want, you can't treat 4 patients at the same time in the same time frame. You have to treat one patient at a time. Put your nose down, treat patients as if they are your family, because society has always required good physicians and will continue to do so. And I hope that you too enjoy learning, regardless of whether you take up your MD, MS degree or not, or continue to do PhD. I would also comment that TDU has multiple programs on Ayurveda associated topics. And I think one of the thing which is very close to my heart, or actually two of them which are close to my heart. One is Ayurveda biology, and the other is their passionate efforts at making Ayurvedic cooking or Ahar Pathya Kalpana very relevant and very useful for today's society. And I know that Megha is part of that team with Dr. Gurmeet. But I would invite, taking this opportunity, multiple of you in the audience to make a point to visit TDU and look at the kind of things that Vaidyas do in that particular cherishing environment. And I think you'll come back more enriched from the experience. My very best wishes for your journey from here to wherever you and God and fate decide to take you. And thanks, Megha, and thank you, audience, A, for keeping your mute and not disturbing the screen and so on. Thanks for that. It's very rare to have this kind of environment.